Hi, I'm Dr. Taiwo. I am a diabetes specialist. I provide care for patients who have both type 1 and type 2 diabetes. Diabetes type 1 are patients whose pancreas do not produce insulin as a result of inflammation of the pancreas and destruction of the gland over time, and so are dependent on insulin. And then the type 2 are those who may be managed with diet, pills, or insulin, and they have diabetes as a result of weight gain and reduced production of insulin by their pancreas and ineffective use of the insulin by the body tissues. My area of interest is looking at how diabetes affects the liver. Diabetes is a multisystemic disorder. It's a chronic disorder. It affects organs such as the kidneys, the eyes, the nerves. But my interest is specifically looking at type 1 diabetes patients and looking at how over time they develop fatty accumulation in their liver, which leads to inflammation of the liver and sometimes scar tissue formation. It's an area of research that is not common and not much is known about how type 1s develop this disorder in their liver. So for my preliminary studies that I've done so far at looking at type 1, there are about 30% of patients with type 1 which over time, as they become overweight or obese, they develop fatty deposition in their liver, which causes the inflammatory changes in the liver tissue. And having fat in the liver and inflammation over time puts them at risk of having other complications such as cardiac events happening, such as a heart attack or a stroke. And so that's why I focus on this group, because not much is known, and as there are some therapies out there already that have been used in patients in type 2 diabetes, it'd be good to see if those therapies will be effective in type 1 as well. And so understanding first how the disease behaves in type 1 is very vital, and then seeing later on if those therapies that are available will be effective as well in type 1 diabetic patients.